Let's talk about iodine. So everyone is scared of iodine. I mean, I've done multiple interviews and I've interviewed with Hakala Labs, and I've even had some feedback. Well, make one of the tablets, and so therefore, obviously, they're going to show that everyone is deficient because it's like a conflict of interest. So
Yeah.
therefore, they're not accurate, right? And there's so many studies that show the iodine deficiency and how our armies used to use it, and just a bunch of things. But why is conventional medicine so scared of iodine? And there's this fear in the space that says if you take too much iodine, you could wreck your thyroid.
Well, I think that's primarily because of the Wolff-Chaikoff effect. So
Right.
up until 1948, every single thyroid doctor was giving Lugol's iodine to their patients for hyper and hypothyroidism. The thyroid needs 12 milligrams, the breast need 5 milligrams. I mean, mucus is incredibly, iodine is really important for all the mucus producing tissues. So sinuses, vaginal, intestinal. But the Wolff-Chaikoff, they basically used radioactive iodine on those mice. And radioactive iodine is the medical form of iodine, right? Where all the medications are laced, the anti-thyroid medications are laced with radioactive iodine, right? Natural iodine is not toxic. Radioactive iodine is toxic. So they used radioactive iodine, they used tons of it. And what it did was temporarily, the thyroid was saturated with iodine. So it didn't need to take it up anymore temporarily for like 2 days, right? So they said that was hyperthyroidism, but they never tested those rats' thyroid levels. So
Oh,
we don't
okay.
know if their thyroid, if their T3 was and T4 were overproduced, right? They never did this in humans. It didn't even show that those rats became hyperthyroid, right? So even Wolff-Chaikoff said in 1969 that it was a transitory effect, and that was not even basically the study didn't work, right? It wasn't true. But medicine grabbed it, has never given up on that, and because iodine is natural, of course. So they recommend with the medicines radioactive iodine, something normal and cheap like Lugol's, which gives your thyroid the potassium iodide, in your breasts, uterus, and in the men, prostate. The iodine, elemental iodine, that's bad for you. Yeah. That's what they want you to believe, right?
Yeah, and it's interesting because everybody I've interviewed, like Lynn Farrow, Dr. Brownstein, they are big advocates for iodine, and it's just there's so much pushback. In
Well,
No, I was just going to ask you, do you think you can overdo iodine? And I'm so in the Hakala Labs, the founder, he said that they did studies with 1 gram of iodine and they have not shown any overdoing iodine. And we are recommending maybe like 12 and a half, even up to 50 milligrams, which is compared to 1,000 milligrams. So have you seen anybody in your practice like overdo iodine? Okay.
no, I have not. No, I have not. It's eliminated via the urine.
Okay. Same page.
I mean, that's in my experience, but I don't know. I wouldn't drink a gallon.
Of course.
Definitely not. You'd be sick to your stomach. Would it ruin your thyroid? No, I don't think so. I think you'd be so sick to your stomach, you'd vomit. And
More people are doing the Hakala Lab iodine test, and they're showing excess levels of fluoride and excess levels of bromide. And so whatever they're supplementing with iodine, it's not even getting really absorbed because it's helping to detox the other halides, as you
yeah,
mentioned.
there's so much more of that. There's so much more. Again, that's kind of the things that what I mentioned before, the substances we can't even see every year. Eat the organization that tells you which chemicals are in the sunscreen, and then they've changed the name, and there's always more chemicals in our water supply, in our air, that we don't even know about. And I just think iodine is a safe, cheap way to detox in the sense that sort of keep your mucus thriving, strong enough to keep stuff out of you. So yes, definitely there's a lot more of receptor pollution.
This year, we had a snowstorm in Texas, and we weren't able to drink our water because the filtration system from the city got messed up. And so one of the recommendations was to use a little bit of iodine if you had it to be able to drink
Yeah.
your tap water. And it's funny because it's like, well, then why are they so anti iodine? I just wanted to clarify. So this is really good. What are your thoughts about some of the companion supplements? So I think with one of our clients, you recommend not to take the selenium. I'm just curious. Some people are saying to take the selenium with your meats. I know that there are some meats that have selenium. I found that it's a mixed bag based on the hair mineral test. Some people, even though they eat sufficient meat, maybe they're not absorbing the selenium. So I wanted to pick your brain about that. Do you think you
Yeah.
need selenium?
I mean, selenium's funny, it can become toxic. So it's kind of not like B12, or it's actually too much of it cannot be a good idea. And you don't need a lot. You
Got it.
don't need a lot of selenium. And I have never had anybody who had a conversion issue. The selenium is important for converting
Got
the
it.
T. That's the D1, D2, D3 are made out of selenium protein. So you don't need a lot. I think that in eggs, carnivore and eggs and meat can get an adequate amount. Usually we used to, as a naturopath, before I became carnivore, I used to recommend 200 micrograms. Now as a carnivore, I would max at 100 micrograms. If, maybe on one of your tests, they come up really low, but I don't.
Yeah. I normally only recommend about, I think it's is one, I forget how much. I think it's maybe 99 milligrams, or maybe that's potassium, but yeah,
Yeah, that's
usually it's a very low dose. So I'm on the same page. And when I talked to Dr. Brownstein, he lives in Michigan. He said in his waters, I guess there's sufficient selenium. So he never recommends supplementing
yeah.
selenium. Yeah. I guess it's really bio individual.
And then the the other cofactors, they're in the meat, basically, it's the zinc, it's sort of in there. And that's why the carnivore diet is so great, that you have all these, if you're eating a plant-based diet, yeah, you're going to probably need some cofactors with your iodine in order to absorb it and synthesize it. But on a carnivore diet, I think you need less.
The Hakala Labs mentioned that when you first start supplementing iodine, that your TSH may go up really high, and that's a normal function of just to absorb
Yes.
iodine. And so I had a client that her TSH went up and it was like 8 something, and she was only taking a couple drops. So I was like, oh, I don't know if that's ideal, but do you see the TSH go up in your clients and then, or your patients, and then you
I
don't see
haven't.
it at all? Okay, interesting.
I haven't, yeah.
Does the iodine impact the thyroid supplementation, the levels?
Yeah. Okay. So the iodine just gives the raw material. I really also recommend iodine, not just for the thyroid, but for breast and
Oh, yeah,
ovaries. And
absolutely. Right.
yeah. So yes, you have to go in a carnivore. You have to have good nutrients and iodine in order to make thyroid hormone. It definitely helps. People usually have a few days, immediately they feel a little bit of energy that they didn't have before. I see that all the time.
I've had some people where they take a drop or two and the 2%, and then
Mhm.
their body freaks out because maybe they've
Yes,
been,
I have too.
okay.
Yeah.
Why is that? It's just they're so deficient that their body's kind of,
Yeah. Yes, or they have too many halides. So if they have a lot of fluoride or bromide, that tiny drop of iodine is just going to make the cup run over, because the body thinks there's a ton of iodine when there's actually fluoride and bromide. So you have to do the, Brownstein salt loading protocol and eliminate that. Usually I recommend 2 days off in between of the first 2 weeks of the iodine protocol to eliminate halides.
or I have a client, I think she's 16, and she was diagnosed as hypothyroid, and she has been supplementing just a little bit of the iodine, and it's been a life changer for her. So that,
Adolescence,
I'm sorry.
definitely. For adolescents, very important.
Oh yeah, she feels night and day different, and it was sad because she felt depressed, and anything that she'd eat would affect her and she'd feel bloat. And then the biggest change for her, because she's struggling with the diet a little bit, but but she's incorporating more meats, but she's just having a hard time removing some of the gluten and stuff. But she's supplementing iodine, and that change has been so significant on her. And it just further, after talking with you and all the other interviews I've done, it's just, I don't know why people are so scared of iodine when it could do wonders for people.
It's very sad. It's a crime, actually, because I really, there's so many fibrocystic breasts. A lot of my patients have their cysts, and then they don't have cysts anymore, or they don't feel them anymore. And then it's just too big. But again, it's natural. So it's the same problem we say all these good things the carnivore diet does. who's going to make money off of that?
I
A
know.
few ranchers and chicken farmers. I mean, so it's not, unfortunately, that is, that has a lot to do with it.
I know. I agree, and it's unfortunate, and the more that we are getting censored and on a
Yeah.
lot of these platforms is unfortunate, but